Hi student, this is my second and final screen sharing that I want to show you. In particularly, this is what discussing the comprehensive health history and physical examination that you may see a um, a provider in a hospital setting or before surgery actually take it. They gather the information and then they put it together and they have it in the chart for you to review. It's a great way for you to know your patient. So if there's what we call an HNP, if there's a history and physical that one of the providers, that could be a medical doctor, that could be a physician, an MD, a DO, a nurse practitioner, or even a PA, anesthesiologist, a CRNA, if a dentist, could come in. If they have done an HNP, that means that it's like a treasure. You can go in there and look at it and really learn a lot of things about your patient. However, as a nurse, you also have to know how to write one of these. Not that we expect you to know it, but I'm going to go through all of the different sections of this so that you can understand which parts are really important, okay, that I want you to know for the test. And then also I want you to realize that why these things are there. Okay, we don't just collect it to collect things, right? Because we just want to and waste people's time. There's always a reason why we collect certain information. And what I'm trying to do is not that I want you to know specific information like this for the exam, but I'm trying to get you a better understanding of the bigger picture of why some of these things are showing up on an H&P. Okay, so I will try to be very clear when I say you got to know this, okay, for the exam. The rest is me telling you information that I think you will find helpful as you move in the program, okay? So we start with what we call the patient identification or biographical data. And I want you to realize that this right here is a subjective information. Because everything from here, and I'm going to keep scrolling all the way down, past all of this, all the way down, the very last part is the review of system. All of that, what you just saw, was part of the subjective information. That means, remember I said in class, that means that this is information that the patient has shared with us, whether you have asked as the nurse or whether it came from perhaps the provider. Okay. Objective information, the objective assessment or information is basically what you do to the patient, what you see, what you smell through all your different senses, okay? In the physical exam portion. That could be the vital signs, as you can see here, okay? That could be, blood pressure, their calculation of body mass index, okay? All of that. And all of that information is called objective information, okay? And what I have put on here is what you would see normally written as what you may see. There are variations, okay? Some people do it slightly differently or they write down slightly different things. But in particularly, this should kind of follow this type of information. Now, what do you need to know for the exam? I need you to know that anything here, physical examination, right? Vital signs, right? And look at the difference, the way that this is written. It's written as if someone is looking at the patient. for the general survey, or they're well developed, well nourished, female or male. Okay, that you can tell that somebody is looking at this patient and they're making the determination. Okay, if they're obese or maybe morbidly obese, like really obese, they may state that instead of well nourished. Okay, if they're under, maybe they're too thin, they may actually put undernourished or too thin. Okay. So I just want you to kind of look at the things that we've already covered, like skin. Okay. These again are kind of like your within normal limits. Skin is pink, or they may say appropriate for race. Color is appropriate for race. Warm, dry, intact, without any lesions. Okay. The hair is evenly distributed and has normal texture. Nails are well groomed without clubbing, cyanosis, or any lesions. Okay. And then this is where I'm telling you, if there are deviations, this is what you may see listed. Okay. Again, what do you need to know? Normal, no normal. Okay. Know that this, when written this way, is part of the objective assessment. Someone, you, practitioner, nurse, are looking at this. Okay. Let's go back to the very beginning. Subjective information. Remember I said subjective information is the client's name, usually the date of visit, the age, their date of birth, gender, race, and ethnicity. There are certain diseases that affect certain races, certain ethnicities. So that's important to say. Marital status. Patient's going to go home. I want to know whether they have support or not, right? Who cares? Where do they live? What kind of things do they do? Employment. Okay. The source is who is providing this information. Sometimes that could be a parent in the case of a child, an infant. Okay. And who is present with the patient at the time. Okay. You need to put that on there. In particularly, you do need to be aware that before you start collecting, like if you're the first person that has to collect this information, you should ask the patient, let them know that some of the questions that you're going to be asking are sensitive. They may not want you to be asking about their sexual, preferences in front of their adult children or their, maybe even their teenage kids. Okay. So they could decide, when you say sensitive information, they could decide to say, oh, why don't you guys go downstairs while she does this? Okay. Always remember that you're not, or like in the case of an adolescent with trying to get a history with a parent there, especially about drugs, alcohol, sex, right? Smoking. You're probably not going to get correct information with the parent there. So you need to get them to get out. My other PowerPoint tells you how to do that. The voiceover PowerPoint on special populations. Chief complaint. Why are they there? The reason for the care. This is usually written, quoted in the patient's own words. One sentence. Crystal clear. Okay. History of the present illness. And this is where you can kind of pull in some related medical information from the review of systems, or maybe some surgical history that is relevant to why they could be there. So for example, if this patient is coming in for a skin problem, okay, and they have a rash or something's not healing. Let's just go with that one. Something's not healing. I think I would want to know that they have had skin cancer in the past and how it was treated and when. Okay. So the history of present illness is where we're going to use our old cart. And I know I already covered that, but here it is again for you. And this is a good one about pain. You should know this. Old cart for pain. You're going to see it again, I promise. And you're going to see it again and again and again as a nurse. You're going to be doing this all the time. Okay? You could also use this other mnemonic that the book may talk about, or other books talks about. So sometimes you'll see nurses putting PQRST. It's basically getting the exact same information in just a different format. Do I care which one you want to use? I don't care, but I want you for this test to know old cart. Okay. Past health history, past medical history, that would include anything that they've ever been treated for as a child, as an infant. Okay. It also includes any type of surgical history. You could list that separately. Some people do, some people put it all together. But don't forget to ask about the surgeries because they go here. Okay. Childhood illnesses, some people do it separately. Some people do it all together on their past medical history. Okay. But what you should write is, like, for example, if I tell you I have high blood pressure or hypertension, you would put that down. And then you should ask, when were you diagnosed with that? And I'll probably tell you sometime around 2009. It's important to put that because there may be more risk associated with certain other complications the longer someone has a disease, such as high blood pressure, or it could be diabetes or whatever. Okay. Hospital admissions. I want to know, were you ever, treated in the emergency room, or did you actually get, admitted to the hospital where you spent the night? Okay. That's more important with chronic illnesses. People who have kind of go in and out of the hospital. This could be someone with respiratory problems, okay, who has, chronic problems, or someone with diabetes that's not well controlled, okay, or heart problems. That's what you want here. An obstetric history is sometimes taken separately as well, but definitely would be important for women. And again, only if you are dealing with a problem below the belt, right, for a woman, abdominal that could potentially, cause that, or you ask this history on a comprehensive health history when you do like an admission into an area, okay, like if you're working in medical surgical floor and you're going to get a new patient. Okay, that patient can come directly from the doctor's office. That patient could come from the emergency department. But I guarantee you, no one has really done a comprehensive health history until you do it. So you got to know how to do this. Okay, the obstetric history, you're gonna write this out in what we call gravity, the number of times that woman has been pregnant. And I'm going to say in, today's world, that person could be be potentially showing as a male, but they are female. Okay. Some transgendered individuals that have not had any actual surgical interventions done yet can still get pregnant, and they may look very, very much like a male, but they still have all the woman parts internally. Okay. So gravity, parity, meaning how many children did you actually have? And the way you want to list this is in preterm, any preterm births, abortions, and those include spontaneous or planned, or what we call terminations. Okay. And then how many living children do you have? Okay. So that's the way that's written. Social history includes tobacco, such as vaping, e-cigarettes. People could chew or snuff or actually, you